All right. Hello and welcome to the third session in the Safe Systems Summer Learning Series presented by the Collaborative Sciences Center for Road Safety, or CSCRS. My name is Kristen Brookshire and I'm a research associate at the UNC Highway Safety Research Center where CSCRS is housed. I'm here to give you all a quick orientation and then I will turn things over to our moderator for today, Dr. Becky Naumann. CSCRS was established in 2016 as one of the 5 National University Transportation Research Centers funded by the FAST Act, aiming to address our nation's critical safety issues. We are a consortium of research partners from 5 universities, UNC Chapel Hill, Duke University, Florida Atlantic, UC Berkeley, and University of Tennessee at Knoxville, with many of our students and researchers participating in or helping to moderate this series. If you are not yet familiar with CSCRS, our consortium recognizes that transportation challenges are increasingly complex and interconnected, and that this demands new skills and approaches to problem solving. We bring together expertise in engineering, planning, robotics, and data science, public health, and other fields to develop new ways to approach our most enduring and complex safety issues. So 2 years ago, our consortium held its first conference, the Safe Systems Summit. It was organized around systems-oriented approaches to address transportation safety challenges. We introduced concepts around safe systems and system science, which can be used to explore system assumptions and interactions. And in this summer learning series that you're joining us for today, we continue to host a space to share ideas and questions around these concepts and to reflect upon the ways in which we as a research and practice community can both appreciate the complexity of the transportation system while continuing to foster shared goals and identify innovative new ways to address enduring safety issues. In the second session of the series last Friday, we had panelists with backgrounds in psychology, planning, and engineering talking about why people make errors in our transportation system and debating how we might design, advocate, or regulate our way around or way out of these errors. As I'm sure you guys can imagine, automated vehicles came up a lot, but they also talked about how crash reporting, media narratives, and other sociocultural factors reinforce safety individualism in our country, and the interplay between political will, public demand, consumer preferences, and many more topics. It's definitely worth listening to the recording posted on the CSCRS website if you want to hear more. So for today, I want to remind everyone that the session is being recorded and it will be posted online. We encourage you to submit questions and comments via the chat. You can also use the chat to share papers or other resources that you think are relevant for the group gathered today. I think we learned this last time, the chat defaults to panelists only. So just make sure and switch it to panelists and attendees so everyone can see the questions and responses, unless you truly want it to just be seen by me and maybe the panelists if they have a chance to look at the chat during the discussion. And if you're so inclined to tweet your takeaways from today, please leave room for the hashtag CSCRS Learning shown on the bottom of the slide. And with that, I will pass the mic to our moderator for today, Dr. Becky Naumann, who is a research assistant professor in the Department of Epidemiology at the Gillings School of Global Public Health at UNC, and core faculty at UNC's Injury Prevention Research Center. She has collaborated on both road safety and opioid overdose related research and led or contributed to many CSCRS research projects. Becky?
Thanks, Kristen. All right, so I want to go ahead and introduce you guys to our awesome panel for today. But before I do that, we do have a quick kind of Zoom poll, and I'll let Kelly go ahead and launch that. So we just wanted to kind of get a quick sense and give you all a quick sense of kind of the different perspectives at least a high level that we have on the call today. So if you'll just take a quick look at that and answer kind of where you're situated. We'll be talking a lot about authentic engagement, redistribution of power, breaking down kind of silos, and wanted to, again, get a quick sense of the different organizations and kind of agency representation we have. So what I'm seeing right now, a lot of local and regional government, that's kind of the lead, about a quarter of us, about 20% or so universities, some private consulting, some federal and state government, a few from advocacy and other nonprofits. So certainly a good variety of voices represented. And as Kristen mentioned, we would love for you all to be part of this discussion. So please do make use of the chat. If you have resources you want to share, if you have burning questions, put those in there. If you even just want to say, yes, amen, that resonates with me, I hear you on that comment. We want you to be part of this and to create this kind of co-learning space. So I'm going to go ahead and introduce, kind of without further ado, the 4 panelists that we have. I'm very excited about this. And I'll just say something kind of very briefly about each of them and then kind of pass it over to them to kind of speak more in their own words about kind of where they come from and some of the perspectives they might be bringing to this conversation. So first we have Aidil Ortiz. She's the principal at Aidilisms, a consultancy that supports the ability of government departments and nonprofits to better connect with and serve people who have traditionally been harmed or underserved by tax-funded systems. She's a longtime facilitator, trainer, organizer, and technical assistance provider, and she's worked on local, state, and federal efforts, currently working on implementing equitable community engagement strategies on a variety of mobility issues, and I'm sure she'll be telling us more about those today. So thank you, Aidil, for making time and space to join us today. We also are joined by Katherine Chen. So Katherine is the Senior Policy and Program Analyst at UC Berkeley's Safe Transportation Research and Education Center, known as SafeTREC, which is a critical member of the CSCRS collaborative. She coordinates on multidisciplinary transportation, injury prevention planning, a variety of research projects, and manages the Community Pedestrian and Bicycle Safety Program, as well as several other community level safety planning programs. So thank you, Katherine. We are also joined by Dr. Destiny Thomas, who is a change agent and anthropologist planner. She's the founder and CEO of Thrivance Group, was recently featured on Good Morning America for her leadership in the urban planning sector. At Thrivance Group, she works to bring transformative justice into public policy, urban planning, and community development. So really looking forward to kind of hearing about your experiences and work as well. And then last but certainly not least, we have Steve Hoyt-McBeth. He is the section manager at the Portland Bureau of Transportation. He oversees bike share policy implementation, bike parking, and transportation demand management programs at the city, and manages Portland's Bike Town Bike Share project, which has been recognized in North America for its innovation in this space. So I'm excited to hear more about that as well. So I'm going to go ahead and turn it over to the panelists so they can tell you just a little bit more about kind of their background, how they've got to their kind of current position. Again, what perspective they're going to be kind of bringing to the conversation today as we launch into some discussion about kind of authentic engagement and breaking down silos. So maybe we'll just go ahead in kind of the order that I introduced you. So Aidil, if you want to start, and then we'll go to kind of Katherine, Destiny, and Steve.
Good afternoon, everybody. I arrived at this conversation from a really interesting road, although I've worked with many people who are graduates of the School of Public Health, where Becky is situated. But, I come to you as a first-generation American, a person whose first language is not English, who grew up working class poor. And I was often the intended target or audience for many outreach efforts in my communities growing up. And I'm certainly still situated in a community that many folks say they struggle with connecting with when they engage for very important processes in municipal life. And so I am a community organizer and member of the community and proud resident of Durham, which is home to the Eno and Occaneechi people. And I say that I'm a public health practitioner second, after 15 years of doing that work, and am a late arriver compared to many people on this call to urban and transit planning, as I realized how important urban and transit plans and those functions were to the success of things I wanted to do within public health. And so that is how I arrived here, through a lens of public health advocacy for community level strategies. And so here we are.
Thanks, Aidil. So yeah, I'll go ahead and turn it over to Katherine.
Hi, everyone. Good morning. Like Aidil, I'm also a daughter of immigrants, and I grew up in a non-English speaking household. And so it was always a challenge trying to understand how different pieces of the infrastructure, how policy, how things really operate in the global structure within the US. And so I've always been interested in public health and prevention, and I started my career in food security and healthcare access. And within that, I realized that in order to build healthy, sustainable communities, we really had to address one of the root causes of our health disparities, the built environment, or really lack thereof in many of our marginalized communities. And while promoting physical activity to achieve better health outcomes, all that stuff is wonderful and great, but that's only works when we have the space to walk and bike safely, where we're not concerned about our physical safety. And so within this is where I kind of connect bridging the gap between policy and practice, where we have to really work with city planners and public health. So with my work at SafeTREC, I began working with the strategic highway safety plan for the state of California. And I had this fortunate opportunity to watch multidisciplinary safety stakeholders across the state really come together on a whole lot of different transportation safety issues. And I was really empowered by that. And it was really wonderful to see. And I currently manage the Community Pedestrian and Bicycle Safety Training Program in partnership with a nonprofit in the state, California Walks. And we provide technical assistance on pedestrian and bicycle safety to communities across the state. We do our best to break down some of the silos that we've talked about that we're going to address today by engaging our residents in transportation planning and empowering them to advocate for walking and bicycle safety improvements. And ultimately, what motivates me to come to work every day is just saving lives.
Thank you, Katherine. That's wonderful. Thanks for sharing that. Dr. Thomas, Destiny, do you want to go ahead next?
Sure. Thank you so much for having me. I am, of course, the founder and CEO of the Thrivance Group. We're also known as the Unurbanist planning firm. I'm really proud of having that reputation in this field because I think our approach to the work is a little bit different from what you would see in a standard run-of-the-mill planning firm. A lot of the emphasis in our work is around planning at the speed of the human element, as opposed to centering the inanimate objects that we call infrastructure, which actually in 2021 don't even really meet our infrastructural needs. And growing up, the experience that I've had, my connection to the environment, my connection to urban planning is very complicated. James Baldwin would call it the irrevocable condition, but it's this idea that I've experienced and encountered so much harm personally and witnessed so much harm in my neighborhoods, my many neighborhoods that I've lived in, that I am aware of and resigned to the notion that our planning processes and interventions as we know them will never work. And so we are all about, of course, assisting building capacity within the urban planning sector, but also encouraging our colleagues to consider a new path forward that centers our social workers, our artists, our dancers, young people, people who have been institutionalized either through mass incarceration or through being in forced institutions like mental institutions, in some cases the military, and in many cases foster care or domestic violence shelters, right? Thinking about the people who are most likely to negatively encounter the built environment and not just centering them out in our work, but allowing them to be the people who lead and facilitate the work and transmuting our skills and our resources to them so that we can begin to heal and disrupt the harm that's happening. So excited to get into this conversation today, and thank you again for having me.
Thank you. Thanks, Destiny. And Steve, do you want to go ahead next?
Yeah, thanks, Becky. Hi, my name again is Steve Hoyt-McBeth with the City of Portland. I use he, him pronouns. I'm really flattered to be on this panel, and I guess I would just say that I don't consider myself a subject matter expert in what we're here to speak about. So I'm really coming today to just really try to share the perspectives that I've learned from community members, the wisdom there, and from some of my fellow staff members. I've spent the last 15 years at the Bureau of Transportation, so I think that I'm really come with a local government perspective. I bring a lot of privilege to my life and to where I've got I've just benefited a lot from kind of the inequities that have harmed other communities have kind of given me a strong tailwind. So I try to come to this with some humility. And I think in terms of the tools that I hope to share today are really about how one in government can use their power to try to reduce inequities in a system that really is kind of is institutionalized supporting them. Thanks.
Thanks, Steve. So I think even from those kind of quick descriptions, I think it's really evident that there's a lot of kind of important experience and expertise to share here related to kind of authentic engagement, authentic collaboration, shared power in kind of decision making and co-creating safe environments. And so I'm excited to get into that. We will talk a little bit more about kind of what authentic collaboration and engagement kind of means and looks like, either kind of through personal experiences of our panelists or other experiences that they want to kind of amplify and discuss. So what does doing this right really look like? Before we kind of launch into that, we wanted to give you all a chance to kind of reflect on your own organization's experiences in public engagement. And we have one more kind of poll. So again, people can get a sense of where our audience is at related to kind of how they think their organizations do related to kind of authentic engagement, related to their transportation research and work. So if you want to take a kind of answer that real quick, and I'll reflect back kind of the results, and then we'll ask our panelists to again kind of reflect on what they think kind of authentic engagement means and looks like when it's done right in transportation safety. So right now I'm saying, so the question, as you all see, on a scale of 1 to 5, how would you rate your organization's efforts in authentically engaging the public to co-create and shape road safety research and practice? 1 being not at all, and 5 being frequent. And right now I'm seeing a lot of kind of 2s and 3s. Most of the distribution is falling in 2s and 3s. So, and I don't think that's entirely kind of surprising from what we probably see in our day-to-day work. So I think we have a lot to kind of reflect on today. So with that, I'll go ahead and turn it over. Dr. Thomas, I don't know if you want to, not to put you on the spot, I don't know if you want to take this one first, if you want to talk about kind of what authentic engagement kind of means and looks like in your work, and then we can kind of go around.
Can you come right back to me? I just lost my AirPod.
Yes, I can. Would anyone else like to pick up with that first? Aidil, do you want to start maybe? Perfect.
Sure. Right before the pandemic got kicked off, there was a really intense project I was involved in for a citywide process known as the Youth Listening Project. And part of what we did is we recruited and contracted with young people throughout the city of Durham. And then we created professional development opportunities for them to grow in their skill set that would be necessary for them to embark on this over a year-long process to create a report of findings, right, after interviewing people and getting themes of concerns that young people had about what it means to grow up as a young person in Durham. What's that experience like? Obviously, as you probably can imagine, transportation was a really hot topic for the young people, and it cut across a lot of different issues, especially as it relates to how they feel safe getting to the various things that they need to do. But contracting those young people, creating space for training and technical assistance of those young people, as well as the adults that work with them, right? So we needed to have some support about understanding the context of them also as our co-conspirators in this work, working with them to write the report, which is now out citywide, and letting them also present on their work, making sure that they understand that this is in their voice and it's out to all the folks, that when this report goes out to the community, that they'll be representing this work and not others, taking credit for their intellectual labor.
Thanks, Aidil. Destiny, do you have any thoughts on kind of what this looks like in your work and what kind of doing this right looks like?
Yeah, and thank you for giving me a second to get my bearings here. So I have a bit of a laundry list that came to mind while I was thinking about this question. And I think the first important thing to do or to consider is what does it look like to decommodify mobility? I think that so often our public agencies and our private sector are interested in finding the business case for things like equity and community engagement. They're looking for data that proves that this is a worthwhile venture for us. And I think when we do that, when we apply this capitalist goal to something like mobility or transportation, which really is a public good or public works services, we will never really arrive at a system that meets the needs of the people who are least likely to be able to participate in normative economic structures. I think also similarly removing normativity from our understanding of what it means to travel or to be mobile. So much of our focus is on moving the consumer to retail or moving the labor to the job site, and not enough attention is being paid to other forms of quality of life, like just basic kinship formation or access to joy. I think meaningful community engagement is, it never ends. And I think that if we can start to develop more models that are based on genuine, authentic interactions as opposed to transactional encounters that are tied to specific projects, we'll be in a better position. Of course, that means our engagement has to be fully resourced in a way that's fair and just, and I think lastly, us having a broader understanding of what it means to have high quality of life in the communities that we're wanting to do transportation planning, because we're going to need to situate transportation and mobility within a much broader context, right? So there's no utility for transportation and mobility if there aren't quality of life destinations for us to go to and from. And I think we are so in love with paths and greenways and bike paths and lanes and parks that we forget why people are needing to or wanting to access those spaces to begin with.
Steve, do you want to add anything else from kind of your, bike share projects or any other kind of work that you've been doing?
Sorry, Becky, the space bar was not letting me go off mute.
No.
I think I would just really reiterate what Aidil and Dr. Thomas said, that it's really about, at a high level, about respecting the time and value of community members' expertise and time. And I think that when we're in the public sector, a big way we can do that value is through making sure that we're providing payment for people's time if they're a community member, and that's been a big kind of shift at Peabody over the last 5 years and trying to get the structures to do it. And then I really appreciated Dr. Thomas's also point about relationship-based engagement that never ends and is not transactional. I just would say that for all of us that work project-based, which is how a lot of local government works, that really takes a big shift in how we think about things, that we're not just doing outreach at a project level, but we're thinking about relationships that we develop over time, and then kind of bringing together many projects to kind of engage folks.
Wonderful. And Katherine, did you have any other comments you wanted to add?
Yeah, similar to what everybody else is saying, it just really is really important to just prioritize what the community needs and to do our best to amplify their voices in our work. Our program's grant funded, so we're accountable to our funders. So some of the things that we work on, we just have to make sure we're not just in a community to meet a grant deliverable, but that we're really listening to what the folks there have to say, and that we're just working with them to help amplify what they're doing. The part of what I'm trying to say is that fortunately we've had a pretty good relationship with our funder, and over time we've been able to offer more in-depth and breadth of our follow-up services in some of these communities. And really, I think the crux of it is recognizing that community members are the experts, not agency staff necessarily, not elected officials. And that while we all might have more academic or professional training in this space, we're not the ones who are in this community day in and day out. We're not the ones that are there at the end of the day when businesses close. So I think, as just a rule of thumb, what we've learned is that we try not to do anything as a one-off kind of opportunity. We really try to build rapport within the communities we work in and try to just have multiple touch points to create opportunities for follow-up services, to provide technical assistance on a more ongoing basis. And I think that's helped us to address some of the historic distrust between marginalized communities that already feel taken advantage of, and not trying to perpetuate that stereotype.
I did want to say, as I heard Katherine speaking about the accountability, right, to the funder, one of the things I think is really important to doing it right is to make sure that you're partnering with folks who feel committed and accountable to the community first. And so like, I'm really clear that yes, even though I have my own shop, like I said, when I identified myself at the top of this, like I'm a community member first and I'm a proud Durham resident. And so if I were to ever be contracted in someone else's community, my first thought is, who are the folks who are accountable to this here? And how do I resource that and make sure that those folks are the ones who are continuing that relationship, deepening relationships and conversations. And so I think that that's a really important part of this conversation when we think about contracting for someone to support and facilitate these efforts.
Yeah, and I think there's a lot of kind of challenges in that space. And we saw even at the kind of poll at the beginning here when I was saying, you know, people are self-rating a lot of 2s and 3s in terms of how well we do this work. I think a lot of us, probably most, if not all of us on this call, recognize how kind of critical and essential this is to creating safer communities, to really kind of seeing operationalize a safe systems approach and a lot of the things we're all working towards together. But I wonder if we could spend just a little bit of time talking about some of these barriers that are in our ways, like sort of what are we up against in thinking about, okay, if we're going to co-create a better system and a better way to do more authentic engagement, what are the things we need to name that are kind of barriers and things we might need to kind of change up in the system? I think we already heard a few of them. I know, Steve, you talked a little bit about kind of just our contracting structures are set up so that to not develop these long-term relationships. They're exactly kind of adverse to them, but I don't know if anyone wants to talk about any of the other barriers they see in their day-to-day work that we need to be very kind of clear and aware of.
I can hop in on and get us started on this. I think there are a number of things. So I do have a civil service background. I used to work at LADOT in Los Angeles. And so I think the one, first of all, the barriers that I encountered in that role are much different from the barriers that I encounter now in the private sector. So I think for civil service, I think one of the issues is we elect officials really high up. We elect our mayor, maybe even our governor, city council members who set the tone and pace for transportation related investments in these communities. And they're not experts either. They did not go to planning school, not that that makes you an expert, but they're not well versed most of the time in transportation planning. And so they have really pie in the sky ideological aims, right? Like Los Angeles's Vision Zero executive order. And they set the wheels in motion, but the agencies that are responsible for implementing those goals or for creating the intervention that communities will actually encounter aren't empowered and aren't resourced to really do things in a community-centered way, right? So the trouble with that is maybe you have staff in the implementing spaces who have values and priorities that are different from the spirit in which these interventions were mandated, or conversely or inversely, maybe you have staff whose intentions go beyond that of the elected official who have mandated these investments, and they don't have what they need in order to do the meaningful work that they're trying to do. From the private sector, what's difficult is there's a vast pool of professionals, so-called professionals, and also advocates who are ready to do this work in a different way, but we cannot compete with the larger entities and firms and bigger names in the field who, for all intents and purposes, just get these contracts handed to them. The RFPs are written with them in mind. And again, I know this from being on both sides of this work. And so the challenge is it looks really bleak in terms of the likelihood of this dynamic shifting, right? So residents don't know who to organize or put pressure on. Is it the agency or is it the elected official? Elected officials don't know really what they're asking for when they ask for certain things. And the money never results in outcomes that are sustainable. So I just think there's a disconnect in the so-called supply chain when it comes to transportation planning.
I'd say another barrier that I encounter in my work here locally is the impact of past consultants and the damage that they have done in our community. And so what ends up happening is this fatigue. And because like y'all have just mentioned before, right, that they're this like one-off project style thing, there's a consultant for everything. And if they're trying to reach out to various neighborhoods and different leaders, those leaders can easily get 20 or more invitations to a variety of processes that vary in quality, vary in respect and dignity to the people that they're asking to basically hand over Rolodexes, institutional history, all kinds of things. I can't tell you how often I've basically been asked to just fork over my email lists and access to like my texting ability without any real kind of respect for what it took to build. I've lovingly curated my neighborhood listserv for the last 12 years for free $3.99, and people feel very entitled to access those things. And so when you know, if that's how they're approaching me, I'd hate to see what they're doing with other folk. And so the impact of past consultants in damaging people's respect for these kinds of processes, and also for, you know, I'm just gonna say it, like, it's a lot of dry, whack engagement going on out here. It's real dry. It's not cute. It's not fun. I leave with less than I had before I came. And so because it's not generative, because it's not nutritious engagement, because it's not authentic, essentially, right? People are like, what exactly am I giving 2 hours of my life for? What exactly am I spending this hour, you know, writing these surveys for? And so I think people just see them as what they are, things of little value to them, because it all gets aggregated in a way that's not useful and represented to whoever their client is in a way that I don't think helps to make better decisions for the city, because we see the outcomes.
Go ahead.
If I could just like kind of try to amplify what Dr. Thomas and Aidil just said. I mean, for the government folks on the call who have a place on the RFPs, we often have a lot of power on how we design these RFPs and how we select firms. And even if we get ourselves in a place where we feel like a larger firm needs to be a piece of this, like how that contract is distributed and what piece of that budget goes towards more community-based practitioners. I think it's a really, I mean, I think that there's a lot of folks that work in government who have an equity ethos feel disempowered. And I just really encourage us all to acknowledge the power that we have and the way that the opportunities that we have to change things, and actually to rewrite RFPs and think about how we, like how we score things, and like how we actually express what expertise and professional expertise looks like.
Yeah.
And I would, oh, sorry, Katherine. Go ahead.
Sorry, Destiny. I was going to echo what everybody else has been saying already, that we have to really address who's being allowed to define the problem. What's this problem statement? Is it something that only transportation professionals are allowed to engage in, or is this something that's much broader? In fact, how we might define this problem, so to speak, might be significantly different if we spent a lot more time listening, because there could be hundreds of reasons why somebody might choose to cross in the middle of a block instead of, say, at the intersection. It could be that that's where the bus stop drops them off. That's where the sidewalk suddenly ends. Drivers don't yield for you regardless of where you're crossing, or simply that I want to. And with the safe system approach, we're trying to look beyond what the individual behavior is, and we're trying to look upstream at all the other contributors. And I think part of that is understanding what the problem is and allowing for a broader group of folks to contribute to what the definition should be and how we work together to find solutions that work for everyone.
Destiny, did you have something else you wanted to add there? Or no? No. Okay. All right. Well, good. So maybe I think, you know, within that vein, I almost feel kind of silly asking this, but I was wondering if many of you have been at this for kind of quite some time and taking kind of step back, 30,000-foot view, do you think that there are glimpses of us making kind of any progress in this space or not? Do we have hope on the horizon with any of this, or are we just really at kind of a baseline of 0 and just have mountains of work to do in this space? What do you all think if you step back and compare to where we were, say 15, 20 years ago in this? I guess maybe not all of us have been at it for that long, but if you take a step back and think about kind of the landscape of some of this work.
I'd like to think that by having this conversation today, we're starting to work on it, and we have to be hopeful that authentic engagement can only improve from here on out, because listening to what everybody else has shared, there's just been so much historic distrust and so much that hasn't worked. So hopefully by having this conversation today and challenging ourselves to innovate and to be better, we do see some improvements, but I'd like to hear what other folks have to say.
I think I share a healthy skepticism as equity becomes like a buzzword that people think is, sexy to kind of throw around without, the real underpinnings of that. I mean, I think about how many people have made commitments through equity statements, but yet the hiring and maintenance of, the leadership and staff at the organizations that make these statements don't reflect what those statements say around equity. And so I think it's really important for us to remember that this is not about people's feelings, it's about outcomes. And so in that regard, I have to maintain a healthy amount of skepticism at this point. I do see some changes, like I get really excited about the work of the untokening, for instance, and their core team to think about what it means to have more people of color within transportation and them be their whole selves within these spaces. And, I get really excited to see, some of the work that other folks on the panel are doing. I've definitely heard of the Thrivance group before today's call, so I was kind of, fangirling a little bit. And as I see people from different disciplines coming into the field, I think that's really dope as well. So just hopefully more of that. It can't come fast enough, though.
I hesitate to answer this question for 2 reasons. I get how important it is for folks to be able to be offered some sense of hope, right? And I'm usually the one that's like, no, this is hopeless, because it is. But I think my hesitation is, I'm so privy to what is happening inside the belly of this beast. And I think systemically and structurally, I don't know that folks are aware of how rotten the inside of this thing is. I, as a small business, as a Black, business owner, there's a smugness that comes with a client saying, we will award you this contract, so you better give us the work that big name firm X would also give us. And I just think the posture, the resentment, the cloaked resentment in folks have about equity trending and racial justice being at the semi-forefront of this discussion really shows up in how we're treating Black and Brown folks who are asking to access power and who are doing the merit-based work that we've been asked to do in order to be in the room. And that smugness really shows up in the ways we could be either inconvenienced or assumptions that will be made about what our purview is or whether or not we have access to the entire Black community. And it's much more high risk and high stakes for us. One mistake means we'll never have business again, which we know. I mean, we just saw a whole building crumble in Miami, and no one has heard that engineer's name yet. But I know that if a Black resident were to say a curse word to a city council member in a district that I'm working on, my business would be blackballed in that community. I would never get a contract again. And so I just think there's some incongruence between the values and priorities that our agencies and corporations are saying they have when it comes to equity, and how they actually treat their employees, their clients, and the consultants that are doing the work on their behalf.
Becky, I do not in any way want to deny the truth of what Dr. Thomas and Aidil were saying, but I thought I would add a couple of examples that that we've implemented at the City of Portland from kind of our BIPOC leadership within the organization and from the community. One of them is that, Aidil talked about how that when she does her work, that she really is first grounded in the community and sees herself as a community resident. And when we look at our outreach partners in Portland, we have a really robust network of community-based organizations that are really grounded in the community. But our procurement process doesn't really allow us to contract with nonprofits in the same way that we do with for-profit firms, and that certainly within kind of the MWE kind of certification process, there's no place for CBOs. And so Irene Marion, who now is actually the director for the US DOT Office of Civil Rights, set up a transportation justice community partnership, which really focused on trying to make sure that we were providing resources for our community-based organizations that really are the ones that are kind of teaching the city and have the strongest connection. I'll just put the link in the chat. I think is one thing that has been proved to be fruitful for us, and really trying to think about redistributing power and money back to the community. It's a small step. I won't say it's like it shifted things, but it's one thing. One of the things that when we put together the first bike share contract that I learned through working with the coalitions for communities of color was using in our contract which they called and we call the high road standards. So we have the bike share practitioner companies that were out there were very kind of like white male centered, and we really wanted to make sure that we shared some of the wealth from that contract with members of the community. And so using the wisdom of Alan Hippolito, who at the time was with Verde and supporting the coalition, kind of put together this exhibit that said that the jobs that were created by this project in terms of the rebalancers, the bike techs, would represent or overrepresent communities that have been marginalized and underserved. And so we required the contractor to kind of actually work with CBOs in order to find those jobs, to make sure that they were accessing them. And I could talk a lot about the limitations of what we've done and what we've learned, but we have seen better results overall because of that.
And I don't want to, so to what Steve just said, I don't want to overlook, I'm just in the deep grind of what it is to try to like get these changes to be thorough and comprehensive and long lasting in my own community. So, in Durham, we have something called the Equitable Community Engagement Blueprint. And so it's hard to be optimistic about something that you have to fight so hard for that should be so obvious, right? So that's the thing, right? I mean, I've had people look at me and say like, do you even like trails, Aidil? Do you even like them? Because the way you talk about, because we had a trail system that is huge, that was getting expanded, and nobody knew about it. And so nobody who wasn't on that committee like 12 years ago when that thing got decided, right? And so that kind of embarked a whole process, and that's part of the whole how I got here story. But the Equitable Community Engagement Blueprint, as we sought to operationalize it, I would say that one of the bright spots is this expectation now where our city manager and our deputy city managers do ask of different departments, how are you partnering with neighborhood improvement services, which is kind of like the home hub in terms of our local city government for integrating different outreach efforts and situating them within the scope of work with contracted community groups that they have helped to recruit, develop, et cetera, because there's a learning curve on both sides, right? As we've mentioned, that the city has a learning curve, or the county, and the community groups in terms of what it means to like lace up and get in something together. And so there's plenty, you know, that NIS here in Durham has done to create, you know, scopes of work, contracts, RFPs, et cetera. And also they can say a lot about, you know, the feedback loops back up to not just deputy managers and city managers, but also city council. And because this is a project, this is a blueprint that the community asked for, advocated for, and went to the map for, it has become an issue that elected officials technically have to run on or speak to in some way. So I think that's really, really dope. But my hesitation of being like, oh, it's such a bright spot is because I'm so exhausted by how much work it takes to say, what the hell? Like, there are so many brilliant folks who care deeply about their city, and somehow all that brilliance doesn't get captured within a process that can work together with community. And that's just disappointing because I get to experience their brilliance as neighbors all the time. And I just think it's a shame how many people miss out on it.
Thanks, Aidil. No, that's wonderful. Oh, sorry, Katherine,
Oh,
did you have something you
sorry.
wanted to add to that? No, go right ahead.
I did. I wanted to take a step back and just kind of comment on how when we're trying to make transportation safety improvements, all of that requires funding. And so much of the funding streams at our state and national level are so inherently based on just crash history and who has access to that data, what communities are able to process and analyze their data to make it useful and to be able to then compete for this dollars, because most of the time we don't have that capacity, especially in our smaller municipalities. And so I really wanted to just kind of share a couple things about that in terms of what SafeTREC has done to address that and what other universities might be able to do also, or maybe agencies could. So SafeTREC developed a transportation injury mapping system tool for California, where we geocode and map all of our crashes from our statewide crash database. And then we make all of this information publicly available to everyone. And communities can download this information and export the data and do additional analyses, but we also have tools within the system that just provide them with basic descriptive analyses with maps of where the crashes are in their community. And I think some of these items are just not talked about because it's a step back and it's something that's different than necessarily just talking about how we talk to our community. Another thing is we have to change the perception that the crash data is the only important information that we need when we're making these improvements. When we're talking about the RFPs, we need to talk about why there might be no crashes, because somebody might be choosing not to walk there because there are other safety issues there. That doesn't mean that safety improvements don't need to be made at this intersection, on this road, on this corridor. And the crash history really doesn't relay what local knowledge there is about the hazards and other things that are happening. As one of the panelists a couple of weeks ago said, qualitative data collection is time consuming, but so incredibly rich, but we don't listen. We don't go out there necessarily because we're limited by what our deliverables are, what our day-to-day jobs already overtax us to do. So I just wanted to speak to that a little bit. And looks like Aidil has some ideas also.
No, I was just saying, as I was hearing you talk about like safety and data and where we're getting it and what we're counting as relevant data. I think it was in one of the earlier panels, probably the one from July 16th, just talking about the things that don't get captured in deciding where things are safe or not safe, like traffic stops by law enforcement and who are they stopping. That all informs whether or not people also have a particular kind of experience within a community. And I know in my area, there was a time at which I could not actually get in or out of my neighborhood without a traffic stop, because our community was put underneath a heavy surveillance tactic known as the bullseye. And so our entire neighborhood literally had cops and SWAT everywhere. And so if we don't think that kind of stuff, those kinds of initiatives by law enforcement don't impede or impact the quality of life or the mobility justice issue in a community, I don't know what to say.
Yeah, I was going to add to that too. Like, what came up for me with the data question is something that I personally encountered as a planner in the city of LA, is like, what constitutes a crash? Like, what qualifies as a crash in our data, right? because folks think, okay, this is every severe injury or every death, right, resulting from a crash. But what folks don't know is who's being extracted from those data sets, right? So in the city of Los Angeles, at least when I was employed there, crashes, the fatal crashes that were caused by police while they were in the line of duty, running down pedestrians during high-speed chases through residential areas with tight streets, those didn't make it into the Vision Zero data analysis or the high injury network count that actually informed how we resourced and budgeted for interventions all throughout South Central LA. Similarly, the dehumanization of Black and Brown folks, the dehumanization of immigrant folks, the dehumanization of people with mental disabilities or cognitive disorders, the dehumanization of trans folks. These are people who, the people who are responsible for doing data collection and analysis will, in many cases, refuse to see and acknowledge as human beings because it's inconvenient for the intentions behind our data collection and analysis. So oftentimes you will see gaping holes in a data set, not reflecting those populations. And then lastly, we have to consider this in a broader context. It's not just traffic safety data. It's what are the other life-saving or quality of life locations that are located in proximity or missing from areas where we're seeing these crashes show up as hotspots in our analysis. If the nearest crisis center or emergency room is a 10-mile drive, of course people are dying at a higher rate in South Central LA, right? Or in areas where there's no crisis center. And that has a lot less to do with investing in infrastructure, transportation infrastructure, and more to do with advocating for and investing in life-saving infrastructure like hospitals and clinics and emergency rooms, right? And so the way we analyze crash data is really unfair and misses the mark in terms of the complex relationship that Black and Brown folks and all the other folks who I've mentioned, the complex relationship we have with just being outside.
Thanks, Destiny. Thank you for that. Yeah, I think as we continue to talk more, I mean, we've touched on a lot of these kind of monumental kind of barriers that we know we face to doing this work. And as Aidil mentioned, unfortunately, a lot of times it's a very, very small, tiny percentage that are carrying a lot of this work, right? And that you hear people that are exhausted by trying to fight this kind of swim upstream against a lot of these kind of structures that we have in place. So, you know, again, as we saw kind of at the beginning of this call, we definitely have representatives here from local, state, federal government, from planning institutions, from public health, from advocacy. So as we really think about kind of better sharing, which we need to do some of this important work, and we know that's a core kind of safe systems principle, that this work is kind of a shared responsibility. Wanted to see if you all had any thoughts on, as we sit in our different organizations, what can we be doing even to start to create small seeds of change and not think, oh, that's, you know, someone else's work, I'll pass it off, that's not really what my job is. And this is probably kind of a hard question to think, because I know we all have kind of different levels of purview, but even for just a couple of entities, I don't know if you all have examples of, it would really be great if you know, if someone wanted to learn more, if someone wanted to dig into this, you should really be thinking about X, Y, and Z, or these resources. Do you all have any kind of words of wisdom in that space that we can, as members of this discussion, each kind of take with us?
I like lifting up the mobility justice principles that can be found on the Untokening website in terms of practice for engagement, and just to get a little your toes wet. There's, you know, I'd say there's some like oldies but goodies, and then there's like some newer things that I always recommend on the engagement front, just to kind of start swimming in sort of the style and the sauce of this. So the newer things, I love Emergent Strategy by Adrienne Ray Brown, which just recently became a Durham resident. I'm so excited. But popular education as a framework for engagement is also something that I'm pretty devoted to. And so Pedagogy of the Oppressed is a really great resource for getting sort of like a primer on that. I also love, when we think about data, story circles. As a practice, as a community practice, we all have stories, and doing that in a way that feels additive and nutritious, as I mentioned earlier, is really important. And so I can drop some links to recommendations for those resources in the chat.
Can you talk a little bit more about story circles for those that may be unfamiliar with that idea?
Yeah, absolutely. So the idea is that there's no crosstalk, and there's a prompt, there's a story prompt. And so there's really great power and ability to frame the stories, or to set up a discussion, right, that is quite applicable to whatever it is that you're trying to understand, understand being the key word, right? And so the idea is that in a group, in a round group, you're all allowed to share your story or your answer to the prompt. No one else is allowed to question or interrupt your telling of your story, and you basically go around. And so everyone offers their own point of vulnerability, and your story stands as what it is. It doesn't get to be altered or challenged in any way, but that deep listening that Katherine was saying, that folks just don't listen. It's so rare that we listen to each other and see each other as people first, much to what Destiny was saying earlier, Dr. Thomas, that we favor these inanimate objects over like people and lived experience. I know when I was reviewing the past comp plan in preparation for our new comp plan process here, in the transportation section, there was actually no mention of people whatsoever. Everything was about moving and managing inanimate objects. There wasn't a single mention of a person or their identities in the entire document. That's crazy for a plan that's ultimately supposed to change and bring outcomes to people, right? Those people were absent in that document. So we're hoping to see that be hugely different this time around, but story circles center people, their lived experience. And like I said, I'll drop more in the chat, but hopefully folks will do more of that as a way to collect data. It does seem, I think there's this obsession with more is better. And certainly I can see instances where that's necessary, but the data you get from a story circle is so rich and offers us more nuance so that we're not just treating complaints in the same way. I think that if people have an issue, you get a lot more at the heart of what the nature of that issue is. And you can't always get that on a survey.
Aidil just went through what is usually my whole laundry list, but I will add that a lot of what informs our approach to community engagement at the Thrivance group, we borrow from the public health sector. And so we believe in using harm reductive strategies. We believe in, in some frameworks that can be problematized, but like housing first models, right? That's a lens that we look through when we do transportation planning. We look at harm reduction when it comes to communities that are experiencing high rates of drug addiction. We're thinking about poverty. We're thinking about food insecurity. We're thinking about how will this intervention we're proposing to our client result in the decarceration of residents in this community. So I think to add to that, I know this sounds theoretical and philosophical, but it is also very possible to apply harm reduction models to your approach to community engagement so that the output of your community engagement results in holistic interventions that anchor transportation planning to a broader system of healing and atonement in the community. And then also my shameless plug is we actually offer a certifying training called the Dignity Institute, where we teach people our methodology for community engagement. We're going to be actually starting and ending our last set of these trainings next week because they are virtual. And next year we will move to in-person service learning format of it, and we'll be in Puerto Rico. So if you really want to know how to do dignity infused community engagement, we have a training for that.
I I don't know that I have as much direct experience as Dr. Thomas and Aidil have both spoken to today, but again, underscoring what I've previously said, just really listening and understanding and valuing local expertise and honoring that, and putting our preconceived notions about what is best aside and listening. And then specifically, I think with regard to authentic engagement, part of it is just recognizing what our role is and what our limitations might be, and understanding that all of us have different, me as Katherine, as an individual, I can do one thing. Me as Katherine, as a person representing UC Berkeley, can do something different. I can say something different. I want to be authentic to who I am, but there are still restrictions in place because of the organization and where I fit within that structure. And I think that we're just having to acknowledge that and work within the limitations of what we can do. Another thing is building partnerships, because some of the things I want to do, I can't do alone within the confines of how I work and where I work and what my funders might be. So I think just recognizing that and realizing that I can't do some of the work, so we partner with with a statewide nonprofit. They recognize that they can't get authentically into some of the local communities that we're working in, so we partner with more hyper-local nonprofits. But on that same token, to what folks have already said today, we can't expect people to work for free. If this is something we would pay a colleague or a consultant to do, we need to also pay the community members. We have to acknowledge that time and the efforts that the communities invest in the work, they should be paid for what we're paying other people to do. People who come from the outside, and that's not fair and it doesn't make sense, but that's just where we kind of are right now, because even though I want to pay people for the work, my grant doesn't allow me to do that. And I have to find ways to work within the confines of what I can do. So I guess that's some things I would want to talk about, would want to think about a little bit more. Go ahead.
There's so many people from like government agencies. So I just want to put in a plug here. Y'all already got the money. You already have the money and you're paying all kinds of ridiculous folks. I'm going to say it because they end up on my front doorstep trying to tell me a thing or two and, enroll me in some program and save my life on Saturday morning, I guess. I don't know. But the point is, when I took a look at how much, this is, community-centered ideal always, right? We did some street level research of our own, right? We had residents attend the meetings of these so-called consultants to do community engagement on a particular transportation issue. And what we realized is that there was like a $40,000 contract awarded to someone for community engagement. And they were hosting 4 different meetings throughout Durham about a transportation project, an upcoming project. This was many years ago. And when we had our street level research team go and just audit who was there from the community, not from the city government, not from the agency facilitating, not from the groups that show up because they have to, who was from legit community. And we realized that less than 12 or 13 people across the 4 meetings actually represented community folk that lived in those respective areas that were going to be impacted by this project. And so if we divide $40,000 by the number of people that they actually got to come out, and half of those people came out because of me, just saying, the point is that we wouldn't hire a community organizer for, $40,000 and be okay if they only touched a dozen people in a year's worth of their organizing time or life cycle. That would be unthinkable. And yet we let that kind of thing happen with city and county contracts for engagement all the time. So you already have the money. Like Steve was mentioning earlier, you just have to create some structures that allow for that money to go to the folks who really got the juice, who really can gather people, who really have those lists. And now that COVID has come, imagine, oh my gosh, how much harder it is for out-of-town consultants or who are not community rooted to try to find a way in edgewise. When this happened, all of the community partners that were contracted under NIS to do engagement work around the census and other transit projects and planning, we were like, cool, we have so-and-so's phone number. We can set up, video Zoom calls to do audits of Main Street before it gets restriped. We can do that because those people already know us. which would have been completely impossible for someone else to do. So the money is already there. You just have to redirect it. We're not talking about new pots of money in many instances. In some instances, maybe, but it's about using what we already have better. Please do not have your consultants call me and ask me for my Rolodex for free. It's going to be a really rude day.
All right, thanks, Aidil. Yeah, so there's one more topic I do want to make sure we get to, and I know I'm kind of keeping an eye here. We have 20 minutes. There's so much more I want to cover, but we did promise that we would talk a little bit about kind of breaking down silos and the importance of that work. And we've obviously been touching on that throughout, and it's very intimately related to all of the discussions kind of we've been having about some of these structures that create barriers to some of this kind of authentic engagement and shared kind of decision-making work. But wanted to see if you all could speak a little bit more about your experiences with trying to get this work done and operating within these systems that exist in very siloed structures. And if we can elevate or amplify any kind of ideas or success stories or things that we can be thinking about to hopefully make some inroads and kind of breaking some of these down, knowing that's where we really need to move if we want a lot of this work to happen better. So I know that's a big question, but if anyone wants to take a piece of it.
From a civil service perspective, I think anchoring public works projects to each other in a more intuitive and natural way, so that it doesn't make sense that your public works agency will be relaying water infrastructure or improving drainage infrastructure, and in the same project area where a DOT might be reconfiguring a road, right, in the same project area where some major development wants to put some hotel that the city doesn't need. And none of the permitting processes, planning phases, community engagement processes, or money itself is being scaled to create a complete vision and a complete final, set of community, elements. So I think that's one way, if we can start to incorporate synchronizing and anchoring projects to each other in the permitting process or the permitting phase of project development. But again, I also think we need to talk about what it looks like to remove a majority of infrastructure related resources decision-making from the elected officials, and start to think about these as community based public works planning projects. And the reason I'm big on depoliticizing transportation planning in particular is because the political nature of it makes it so that the folks who our political system has never favored never see interventions that are for them and are never meaningfully engaged to even, conceptualize what it could look like to have a complete community.
I was gonna say, and there was a little something in the chat about, that I think goes to what I was gonna say around silos, about the money. So, even if you don't have clear money, there are channels for engagement based on culture, joy, and play that exist in everyone's community, right? Everyone or many people have arts councils, parks and recreation departments, and other places that are about neighborhood engagement in some way, shape, or form. And if you're not seeking, so to the point of silos, if you're not seeking partnerships with the existing channels that are within your municipal government to figure out how you can best complement each other and understand each other's processes and how you might ride rails together so that communication is more seamless and you don't miss opportunities for getting out into community and being able to get more information about critical functions and processes and feedback and et cetera, then you're really missing out. I know it's been really frustrating here that yes, transportation and planning and NIS and even public works, so it's fun to hear Dr. Thomas mention about public works, because part of what I did there to break down silos as the lead public engagement vendor for SW77, right, which is our sidewalk. We were doing our inventory of sidewalk conditions. throughout Durham, but we started with saying, who can access this data? Me asking that as a contractor, who can access this data, and what, how can we be thoughtful about who it gets shared with? Because sidewalks are a part of people's community experience that is, pun intended, very pedestrian, very accessible. Everyone has an opinion about sidewalks. So when I start getting out there, people are going to have a lot to say, and some of it's not going to be specifically about SW77's scope of work. So how can we be thoughtful about what people say and bring into the process so that it gets shared to the respective programs? Maybe it doesn't belong at Public Works per se, but sometimes the stuff that gets back to me belongs lovingly in transportation or economic development or one of the other departments, and being thoughtful in advance about saying this will be communicated to the respective parties that can do something about it, and being able to make that promise to community as well. But in terms of the silos, being really clear with your lead staff at that department about how information will travel, and collecting information in a way that is mindful of that, because people are not having an SW77 experience. They're not having a transportation department experience. They're having a community experience. And so you have to think about that on the front end every time you get in the room.
Yeah, I would just mention again, because I think it's really great work that Irene Marion did in Portland. Just the Transportation Justice Community Partnerships is another way of just trying to channel money back into community. I really would just say for people in local government and state government, I know it gets harder the higher up at the branches go, but to spend some of your time, if you really care about kind of dismantling structural barriers within your institution, with your procurement services group, make friends there, look to be creative. And like, as Dr. Thomas and Aidil mentioned at the beginning, like relationship-based engagement means developing relationships with your organizations and community partners and finding out what their priorities are, and then using some of your time to go after other grants that may be foundation-based or other grant-based, where you might have a little more latitude in how that money is spent. And be sure that when you go after that money, like make sure the money, that grant money stays with the community. Bring your resources to help write the grants, and then like have the money live with the organization so they can kind of build their kind of institutional capacity, and not have it kind of all filtered back to you and you be the one holding the purse strings.
I guess what I want to say here is that you don't have to be a transportation professional to have a stake in traffic safety. Do you personally feel safe? Do you have what you need to live, to thrive? Do you feel safe walking around, biking in your area? Do you have access to food and other social services? Is that connected to where you live, where you work? Can you access it by walking there? Can you access it by biking there? Is it connected to transit? Do you need to have a car to get to it? I mean, all of these things are just kind of are bigger questions that we just have to ask ourselves. And in my work, I've found that non-traditional partners have done an amazing job breaking down some of these silos in a way that they just invite the transportation professional into their coalition to improve the livability and the sustainability of their communities. And I think one specific example I wanted to cite is that we worked with the community of Muscoy, a low-income rural community in San Bernardino County in 2019. And this was a group of primarily monolingual Spanish-speaking parents under the guidance of one very, very strong champion, one mother who really wanted to improve safe routes to school for her children at the local elementary school. And she invited us into their community to convene a CPBST workshop to engage the community to work on safety concerns more broadly, and to co-create an action plan and develop a set of recommendations to support an active transportation program grant application in the subsequent years. And fast forward a few years later, Muscoy applied for their funding through the state's active transportation program. They had the third highest score of all the applicants, and the entire program cycle had a success rate of about 22%. So this one woman, this one mother really spearheaded this effort and got elected officials on board. She got all the other parents at the school on board. She got transportation professionals and so forth. And they now have a $1.8 million grant to bring infrastructure improvements to their community. They're getting sidewalks, they're getting crosswalk markings. And I think all of this is that you can break down the silos. It doesn't have to start from the transportation professional and anyone can do it. It's hard work. It takes a long time. And you just have to celebrate the little milestone wins that you can along the way and find your way to do it.
Thanks, Catherine. Oh, Steve, did you have something else you wanted to add to that? Okay. So I know we had at least, Kristen, I know we had at least one question. I wanted to make sure that people had a chance, so it wasn't just me kind of throwing things out there, but if anyone else had questions for the group, so please go ahead and enter those in the chat. And if you had it earlier on, if you want to re-enter it in case it got lost. I know, Kristen, there was at least one that you had flagged, maybe to circle back.
Yeah, I wanted to check. It was more of a comment than a question, but Catherine had flagged it as maybe being, we're kind of past where that came up. Yeah. Catherine, did you want us to go back to that one again?
No, that was something that I needed to address personally because this was somebody I had worked with before. Sorry, I didn't realize who I responded to when I did that.
Oh, okay. I was like, I'm not sure what the question is.
Sorry. Yeah.
No, that's good. Well, if there are any other questions, feel free to enter them into the chat, or if the panelists have any questions for each other or things that we didn't bring up.
I was just going to say one thing.
Please.
The thing, there's always like the outer, we're always talking about like what's going on out there. And then we fail, I think, often to talk about what's going on in here. We're all being consistently re-indoctrinated into a particular set of beliefs. We live in a white supremacist, patriarchal, capitalist system, and every day we're being retaught that stuff every day. And so we go out into the world and we replicate what we take in, we put out what we take in. And it's really important for us to have our own processes for scrubbing and exfoliating that stuff off of us on a regular basis. That's why you have to be a practitioner of this stuff. It's not, I went to one workshop, that was great. No, you have to be a practitioner and a student to recondition yourself on a regular basis. It has to be a commitment and a journey around valuing and centering people and communities over inanimate objects like cars and buses. And so whether that means in, bringing into your own spaces, the centering and remembering. I loved what Catherine was saying earlier about like, you have your own knowledge, you have your own, even if you're not a transportation professional, you're having an experience too. Go back to that experience. So we need to feel our way through this work also from the neck down and not just from the neck up. There's a lot of really great high level thinking. I don't want to dismiss it, but we know in our bodies when a space is not safe. We know in our bodies when the work that we're doing in our offices feels icky or taxing or dismissive. We know in our bodies when we're like, gosh, this isn't really bringing me joy. And if it's not bringing me joy, do you really think you're passing on joy in the engagement of your respective communities? Like, it's impossible to do that. When was the last time you shared your stories with each other about how a process, a project, or a particular, thing that you're doing makes you feel or inspired you, or, do you know where each of you are from? And if you're working with people where you don't know where they're from, you don't know anything about them except their job title and the office number that they sit in, I'd be hard pressed to believe that an institution, any office or department where that's their internal culture could ever go out into community and expect to produce something different in the way that they move. I just can't see that happening.
Thanks, Aidil. Yeah. I'm also monitoring the chat a little bit here, and I think we have a couple of good questions, and it looks like we have about 10 more minutes. Maybe we will try to get to a couple of them. There was a question on specifically engaging with victims and survivors of traffic violence as a specific group that's experienced harm, but maybe kind of dispersed across communities. So how to kind of really engage specifically with that group. And I don't know if you all have experience kind of in that space or have thoughts on engagement of that group.
So I do have experience doing survivor engagement, but my mind takes me back to just the really different aims and intentions that show up, like depending on if you're an agency, if you're in the private sector, if you're an advocate or activist. And so, I distinctly remember doing survivor engagement and wanting to be able to use engagement resources for things like vigils and, prayer circles and, healing circles and getting together to have like dialogue with community. There was one neighborhood that, has some issues with intra-community violence, the presence of gangs, but also very a very large language barrier between the Black and Brown folks. And so it was not just that we needed to do survivor engagement, but that we needed to facilitate or be a part of a discourse, a discussion, to be able to understand our experiences a little better. And that not fitting into the narrative or framework of what it means to do survivor engagement in the transportation space, which to me can feel more like interest group building work and maybe on a good day coalition building work, but not necessarily healing work, atonement work, and interpersonal resolution and transformative justice work, right? So that's really challenging. But I think if we're talking about the interest group version of survivor engagement, I think moving away from regional distinctions altogether. I'm always troubled when I see, the long list of so-and-so for safe streets groups or, the survivors groups that are based solely on this small city that you're in. And really wanting those survivors to have access to resources that I know they will not have access to if they continue to silo themselves from other people who've experienced not just traffic related violence, but violence in the built environment, which forces us to think about white vigilantism and the attacks on people with cognitive disabilities and the policing that happens, sometimes, being advocated for extensive policing by people who are also victims of traffic violence. So there's some major differences in our causes that I think we will only resolve if we start to merge some of our silos and affinity groups to have road discourse.
I had one other question related to kind of engagement and working in, potentially, well, many communities may fall into this bucket, but polarized communities, I guess, where the majority's view in a community may be overtly harmful to other members of the community. And I guess I don't know if I'm getting the question specifically right, but potentially handling that in community engagement strategies. I don't know if you all have experiences in doing kind of engagement work where you had very strongly polarized views and kind of navigating that. It's a tough one.
I'll just say that I'm not on the Vision Zero team, so I'm just going to drop my email into the chat and connect people if they want to talk to folks. But the Vision Zero task force that created our Vision Zero plan included community activists and the police. And what we saw in the data was that there were a lot of crashes caused by speeding, and the community said we do not want to see police enforcement as part of our Vision Zero plan that has a lot of, it's going to have disproportionate effects on the community. And I wasn't a part of that. So I can just say that I'll just drop my email in the chat if people want to connect with the folks and they can talk through. It was a very tough discussions. And we really learned a lot from the community through that. And that was where 6 years ago, just what Dr. Thomas just kind of said very eloquently about how that traffic violence doesn't just mean that you've been involved in a car crash. Like if you're walking down the sidewalk and somebody spews racist violence at you, that's a traffic victim. And so anyway, I'll just go ahead and drop my email in the chat.
So this, this is the not pretty, right? I was on the planning committee for the statewide conference for Bike Walk NC's upcoming conference, and I've had to withdraw from that, mostly based on their inability to commit to a particular, their inability to commit to not increase the presence of law enforcement within their in-person programming. And I think that given some of the things I've just mentioned about the over-policing of my particular neighborhood, there was a desire to host like in-person or on-site things around like bike safety, et cetera. And, you know, there was some duplicitous behavior on their part about how to keep information from me specifically about their desire to involve law enforcement, especially given some of the source of their funding with some state level funding that's connected to law enforcement. And I, you know, for the sake of my commitment back to, you know, who I answer to my neighbors and of course my own desire for personal safety. And I don't feel like that is appropriate for me to be connected to that kind of stuff. So these kinds of issues can cost people the ability to have meaningful partnerships, and lines can be drawn. So I can't say that it was resolved other than to say that I withdrew from the committee. A statewide group that also advocated against some of the cautionary, the resources we wanted to have caution in a planning process around our trail system here in Durham. And so I think that it's really interesting that they now want to host their conference in Durham, mostly I think to co-opt the really hard labor of groups like mine and my political home as Spirit House.
I think it's good that you brought that up, Aidil, because I think I'm not one that's interested in like helping everyone to feel comfortable in what they believe to be a polarizing environment. I more so have personally, and I'm encouraging other folks who are like-minded to walk away from tables, right? So similarly, Thrivance Group has left what would have been some very high-profile partnerships because of their discomfort with us using the term reparations or us not having a middle ground when it comes to incorporating enforcement as a primary aim of a Vision Zero platform, right? And so I think the negotiation process in those relationships in and of itself brings an added level of you in some ways, by being there to negotiate with these would-be partners, you're consenting to the intentions and the aims of those would-be partners. And so it's best to just draw a line in the sand and say, you know, luckily it's not just one voice in the field anymore. I myself am walking away from this partnership, and I'll be reaching out to my colleagues who are like-minded to encourage them not to work with you either. And I think the more we do that, the less we see this fear of polarization morph into Black and Brown communities not getting what they need.
I want to also say, because August is right around the corner, y'all, I can't believe it, that, you know, in this first week of August, another thing with like taking back streets and feeling safe outside that's been sort of heralded as like the thing to do, which is also a law enforcement partnership, is National Night Out. And I am not here for it, just FYI. And so I recognize that I have people in my community that have a tradition of doing National Night Out and bringing out police and fire departments. I instead would recommend that people check out the Ella Baker Center for Human Rights' Night Out for Safety and Liberation, which does not encourage or require the use of law enforcement. And they are my favorite. And so they'll be hosting it on August 3rd, so it tracks at on the same date. But if you go to their website, they've got wonderful downloadable resources that you can use in order to implement this and have a night out that doesn't require extra policing.
Thank you, Aidil. Thank you, everyone. I really, really appreciate you taking the time today, and especially to Aidil, Katherine, Destiny, and Steve, lending your stories and experiences and all of your expertise on these areas. So thank you very much. Kristen, I'm going to go ahead and should I pass it back over to you? Do you want to say a couple of words about the rest of the kind of panel sessions we have coming up?
Yeah, so we're halfway through. We've got 3 more coming up. I've got short descriptions on the screen, and the link that I most recently shared in the chat is where you can go to register for any of those or check out the recordings. The recording from today will be available middle of next week, but you can also look at the first 2 sessions, which it was nice to hear people refer back to those throughout the session today too. So thank you everyone for sharing your knowledge and experience with us today.
All right. Thank you. Have a good weekend, everyone.